Okay. Hi, I'm Alvin Leong. I wear different hats. I'm an academic. I'm a fellow at the PACE Global Center for Environmental Legal Studies. I'm also advisor to some NGOs. I've worked a lot with the major group for children and youth, and they are very intelligent and dedicated bunch of young people. And in the Habitat 3 process, they have been very involved, and that's very commendable. One area that we have some synergy with is science and technology, or science, technology, and innovation. And I think the major group for children and youth has really pushed the science agenda. Science policy interface, it's in the new urban agenda in a couple of places. The linkage with the technology facilitation mechanism, which includes the Science, Technology, and Innovation Forum, that was a big push by the children and youth major group. So those are big successes if you really look at the new urban agenda. You know, the focus on science, technology, innovation, and really establishing linkages with the scientific and technological community. So I think that I wish the major group for children and youth well. They've done a great job in the Habitat 3 process. Things can always be improved. There are always issues with coordination with other groups, maybe questions of what could be a more effective way of coordination. But in terms of the agenda, they're very clear as to the path they want to pursue. And another area is environmental as well, which also to be commended. You know, they've been pushing planetary boundaries, the concept of environmental sustainability. So these two prongs of science-based and environmental-based advocacy really augurs well for the future, because the youth are our future and the planet belongs to them and future generations. So continue the great work, great job on the new urban agenda. You see their handiwork in there. And now we move on to implementation and follow up and review. And children and youth have a major part to play in both implementation and follow up and review. Good luck. Thanks.